Hello, I'm Dr. Omar Bey, and this is A Moment in Medicine. Our focus is health, education, and wellness. Our goal is for each and every one of us to have that opportunity to grow old in good health. Welcome to our show. Well, we have another show that's excellent. We're going to talk about dementia and Alzheimer's tonight. And we have a perfect person to talk about this. I'm just so proud of the guests that we're bringing on because they're just so learned, such a learned people. So, but first before we go into that, let's talk about our usual caring and sharing. We share our med moments because we care about each other. And what is a med moment? That sign or symptom that lets you know that you have to visit your doctor, that something just may be wrong. And when you share your med moments with others, then they will be more likely to go see their doctors. That's what it's all about, sharing and caring. Remember our website, www.medmoments. Don't forget the S, medmoments.com. Yes, email me. I love the emails. I'll respond to them. Send them on. Also, you can tweet me at MedMoments. Well, let's get on with the show because we have a topic. And as I stated before, it's dementia and Alzheimer's. And I have the perfect person to discuss this particular topic. It's Dr. Nelson Alua, and he's assistant professor of medicine at Rutgers University Medical School. Dr. Alua, welcome to our show.
It's a pleasure.
All righty. Thank you for coming
to
discuss this topic because it's such an important topic. We all get old. And it's a good chance that one or two of us, you know how they say, sit in an auditorium and look to the guy, look to your right and look to your left and somebody's going to have it. There is a good chance dementia may be a part of our lives one day. So we're going to discuss this. So I'm going to start off with my first question. And it's always the basic question. What is dementia?
Well, dementia is, in very simple terms, is a progressive loss of memory that's severe enough to affect the daily function of an individual.
Right.
And it's a disease that has increased in number among the elderly population in more recent times than usual.
Right.
And it's something that has become, over the years, becoming a major health medical problem and the social affectations that involve in dementia also.
Okay, all right. Now let's just step back for a minute because what we're really talking about here, what we're talking about is the brain.
Yes.
So tell us about the brain a little bit. I mean, it's a fascinating organ, I'm telling you, but not many people talk about it very much. We talk about the arm, we talk about the heart, we talk about the lungs, but we don't talk about the brain that much. Tell me a little bit about it.
Yes, the brain is about the most powerful organ in the body. It weighs about 3 pounds. Yet, in a very resting brain, it takes about 20 to 50% of the function of the blood that comes out of your heart. And increasingly, it takes about maybe 50 to 80% of the function of the blood that comes out of your body, of your heart also, including the amount of oxygen or food that you eat. It takes that amount of
like some of the nutrients.
Of the nutrients that is needed from the body.
All right. So let's step back because this is new. This is news to me. What you're saying is that the brain takes so much blood supply. I get, say if 100% of the blood was coming out of my heart.
Right.
20%, when I'm at a resting state, meaning I'm just sitting there cooling out, chilling, looking at the TV, 20% of my blood is going to my brain.
Correct.
And the nutrients and all the proteins and calories and everything, the oxygen and all that's in my blood is going to my brain, and the brain is sucking that 20% out of that too.
Correct.
And it can go up to 80%?
80%. If you're in high functioning state. Wow. For instance, if you're thinking seriously, or if you're really very active, performing sports, or doing something of high intensity.
Right.
It takes that amount
wow.
from the body.
So it's a major player as far as the body is concerned.
It is. It's a major player in the function of the human system as a whole. Because if you think back, if you as well, you know, it's about 100 billion cells that make up the brain.
100 billion.
Yes, I have about 100 billion cells. So that's a lot.
Yeah.
It takes a whole lot of capacity to maintain those cells.
Okay.
So that's how much it consumes.
Now, I know that the brain can do a lot of things, but do we use most of our brain? Are we functioning like when we're thinking or walking, or is all of our brain working, or is some of it kind of cooled out and just
science have actually shown, and it's a common saying, that we don't use all the capacity of our brain.
Okay.
And that's because if you take it from evolution, you've noticed that we have become smarter and smarter over time.
Right.
And that's because most likely that science has shown that certain portions of the brain that we've not actually been able to harness, we'll be able to, we have the ability to do that these days.
Oh.
So, and that's the reason why the increasing amount of the portions of the brain that we use probably over time would increase. However, right now we really don't. But the irony is the brain really does not rest, or it doesn't go to sleep. So even when you're sleeping, the brain is still functioning. And that's why in resting positions, it will take about 20 or 30 or 40% when you're asleep, because one, the heart still needs to beat.
Right.
It needs to tell the brain, it needs to tell the heart, let's beat. It needs to tell the stomach, if I'm hungry or if I'm not, absorb this tissue. It needs to tell, the vessels to stay open. It needs to tell a lot of things to go on. So that's the reason why the brain never goes to sleep.
So it's the major computer.
It is.
And without it, everything stops.
Everything.
Oh, interesting. Very interesting. Now, let's just get back to some of the things that we use every day that we would know the brain is working. Things like sensation or sight and stuff like that, and sounds. Can these things cannot actually happen unless the brain is working, is what you're saying?
It would be impossible for a lot of all these things to happen when you're conscious. Right, because when you're awake, the brain tells every system of the body how to function. It's like the major traffic zone, directs what goes on, what needs to be shut down at what time, and what needs to get up to perform its duty at what time.
Right.
So if you have to think, when you're awake, it does the thinking for you.
Right.
If you have to feel, even when you sleep, you find out that you sleep, somebody touches you, the stimulation goes up to the brain processes it and reinterprets it to let you know you're actually being touched. And what kind of touch? Is it a touch from light touch? If it's a touch from a loved one? If it's a touch from the touch from pain?
Right.
Is it a touch from even a bad sensation like pain or fire? You understand? So all of those, the brain really does perform those functions.
It really analyzes it all. Interesting, very interesting. Now, tell me about how the brain works also. And we're going to get to dementia in a minute, but this is just so interesting. Right side and left side. Somebody was telling me that if the right side of my brain is not functioning well, then why does the left side of my body is the one that's having the problem? What is that all about?
Well, essentially, that's how the brain has been formed.
Okay.
You have two halves of the brain.
Okay.
The left side and the right side.
Right.
And the nerve fibers that connect from the lower legs of the toes up to the brain, and from the arm up to the brain. And these crisscross at the middle in such a way that even the sensations from the eye also crisscross. And the same portions where some remain on one side and the others remain on the other side. So, and that's the way it evolutionary or, creatively, that's how it's been made.
That's how it's been made.
Correct. So the left side actually controls the right side, and the right side controls the left. So if you have a problem on the left side, let's say, for instance, a stroke that affects the left side, you find that the right side goes numb, goes weak, you don't have function on that side.
Right.
If it's on the opposite side, the same thing happens.
Right.
So also with speech, you have areas of the brain where the speech center is located. So if it's on the left side, usually it's on the left side. If it's on the left side and you have a stroke that affects that area, then you have a problem with speech. And that's why those who have stroke can't talk.
Right.
Or they have problem processing the information that they get.
That they're getting. Interesting, interesting. Well, let's talk about a little bit of the main topic is dementia.
Right.
All right. Now, I understand that this happens most of the time to elderly people, but I have a question. Can it occur in younger folks?
It can. Dementia is more of the most common aspect of Alzheimer's. Is actually the most common aspect of dementia.
Okay.
It's about 50 to 80% of people who have dementia have Alzheimer's.
Okay.
And it's very common among the elderly. However, you have early onset and late onset. So the early onset do occur in younger people. On the average, about age 40.
Oh, all right.
Right. So while on the late onset usually begins on a much later age, 60, 65 and above.
Okay. So when you said younger, I was thinking like teenagers, right? But it doesn't happen that young.
No, not
It's
that
usually
young.
about 40 years old.
Usually in the
it
40s,
starts.
yes.
And then, you know what I mean? That would be an early onset. But most of the time, it's 60 and above.
Correct.
Alrighty. And what actually happened? Do we actually start forgetting like where we are and who people are and stuff like that? I mean, and is there a distinction between dementia and Alzheimer's and how it plays out? As far as what happens to the person?
Yes. Alzheimer's is a slowly progressive disease that affects the brain. And like I said, the effect can be early when there's a genetic component to it, or there's a major affectation of the brain. It can be late when, for late onset usually, they haven't had a definite cause for late onset dementia. And it usually progresses in the sense that the tissues of the brain, as we grow old, every tissue in the body dies. The brain is not an exception. So the brain tissue begins to die slowly. And as a function of the brain performs its function via chemical networkings as well as electrical networkings. So these chemicals pass through the nerve fibers to the end of the nerves and then send electrical impulses from one nerve to another. So those nerves progressively will die. And as it goes on, all those areas where the nerves are dying on time leads to areas where you have problems, with the onset of dementia. So it can begin with, one, forgetting things easily, getting lost in most of the times familiar places, forgetting to perform daily tasks, forgetting to recognize, family members as it progresses on, forgetting to, perform certain activities or daily things that are required for you, even as much as avoiding social environments. So those are the early symptoms or signs that they present when people have Alzheimer's.
Okay. Can you prevent this from happening? Like, is there a way that I can prevent, dementia from occurring to me?
Well, prevention, there's no specific way. You can say, dementia or Alzheimer's can be prevented. If it runs in families, it runs in families. The essence is to recognize it when it really begins. And that's why it's paramount that you get a very good history from your family. If it runs in families, you need to know. If you understand, if you speak to your dad and grandpa had it, then you begin to, watch out for PAPs when PAPs really begins to grow old. And you pass on that sort of information to your younger ones. So they begin to recognize when you begin to have those personality changes. Those are early signs, symptoms that may really begin. So it's important that a family history is really, the knowledge of what the family history is really very important. So that you begin to see those things and begin to be aware when it begins to come, they begin. And then take steps to avoid any precipitating factors that can can result in it. However, when it actually comes to the risk of Alzheimer's,
Right.
one, age is a big factor.
That's the case.
Two, genetics. Like I said, it runs in families.
Right.
Three, some records of medications or side effects or long-term use of certain medications have been risk factors for dementia.
Right.
Stroke, infections of the brain,
Right.
tumors or cancers of the brain, long-term chronic diseases like uncontrolled diabetes, uncontrolled kidney disease have been a big risk for Alzheimer's. However, one of the ones that we really can't pinpoint to is long-term progressive use or severe use of alcohol is a big risk factors
For dementia.
for dementia and Alzheimer's. So if you tend to avoid certain things, control your diabetes, control your blood pressure, avoid stroke, yes, probably you can avoid, development of Alzheimer's.
Right, right. I heard you say something that struck a note. You said personality disorders. Do people's personalities really change? Like if somebody was a very calm person and now all of a sudden they're angry all the time, or if they're, they're starting to become abusive or something like that. Can that be a sign that something like this is coming about?
Yes. Personality changes actually do occur in a more progressive, severe aspect of Alzheimer's disease.
Okay.
Before you begin to get that, you would notice, the forgetfulness, the avoidance of social functions,
Right.
Being lost. Those you pick up early. Now, the other personality issues about, being angry all the time. Yes, you can get that in, moderate to severe cases of Alzheimer's, where they begin to get a little angry all the time, probably because they still have a low portion of the cognitive function. And, if grandpa or grandma is so used to doing things by themselves, they're so independent, and all of a sudden they realize that they're losing the ability to do this.
Right.
Anger is one of the things that really, will begin to show up.
It presents it.
So, and it's important that you need to recognize that and, begin to not show the same kind of anger or get angry as a family member, but begin to really understand, that is, a portion of the disease that's in progress.
Is dementia a normal part of life that we just have to accept that it's going to happen to all of us?
No, it's not a normal aging process because not everybody gets dementia.
Right.
Again, there's age, there's family history, and the lifestyle that you use, that you lived. So like I said, the genetic components, the environmental factors, and the lifestyle. Right. Those are etiologic factors that can predispose you to Alzheimer's. No, not everybody gets Alzheimer's. Okay. However, it's been said that the more educated you are, the less chances of you getting Alzheimer's. The reason is because if you're really very well educated,
right.
you know a lot more words. For instance, rather than saying, it's very important to perform this task,
right.
an Alzheimer's person will forget the word important, but because he's so well educated, he will say it's imperative that he perform this task. So the choice of words is what an educated person would use because they are able to confabulate, meaning to use different words of the same meaning to address an issue. That's the reason why.
So that's why they think it is.
Yes.
I've always thought, though, from what I've heard, is that people that use their brain, meaning that functions like reading books and being very interested in looking things up and conversating and stuff like that was the reason. But I never heard that. Right. That is truly extraordinary because you have more of a choice of words.
Correct.
So you do have dementia or Alzheimer's, but you have so many words.
So many ways to go around it, and then people don't notice on time that you have Alzheimer's.
All righty. What about as far as lifespan? Does it cut down on the lifespan of these people?
Unfortunately, it really does. And on a majority of cases, most people don't recognize Alzheimer's on time. Studies have shown that it really can begin 20 years before the diagnosis of Alzheimer's. So 20 years before that, they may all have Alzheimer's. Like I said, the professor who's very good with multiple words may be having it, but people don't pick it on time because he can go around those words. So it can begin 20 years and above, but the on an average, between 4 to 8 years. When people begin to make the diagnosis. And then on the average, from the onset of diagnosis to in rapidly progressive cases, can live up to 8 years until, they pass on.
So I may be in trouble when I forget my keys and where I put them. I'm in trouble, right? I start thinking about this now.
Well, I know. I haven't had, I get people ask me about, oh, doc, how about when I forget my keys?
Right.
Or I forget where I park my cars, or on all those little, daily things.
Right.
Does that mean I have Alzheimer's? Most likely not, because intense emotional concerns.
Right.
It's a big issue also. I mean, there's a difference between Alzheimer's and dementia or memory loss from severe, intense emotional distress. For instance, loss of a spouse. It's a big issue. A major catastrophic event in one's life, a big issue. Sometimes even retirement. Can be.
I don't think that I'm going to have a problem with that.
So little things here and there, no. It's not an issue.
Okay. What about as far as race? Do you find it more in one race than another?
No, it affects everybody. Everybody, every race. All through, from the Amazons to Alaska to the Cape Coast in South Africa. It's all through, around all ages, all races.
Alrighty. Is gender any more in females than males, or males than females?
No,
Really
I mean,
either?
some people say there's a little preponderance, meaning a little increase among females, but not essentially.
Okay, all right. Some of the things that you were saying, that some of the early signs is people really start avoiding contact with other people.
Yes.
Not going around and stuff like that. It's because I can imagine that happening quite often. You know what I mean? And you really don't think of that being a problem or a disease, put it that way.
Right. Usually it happens in the early phases, and probably at those stages they may begin to realize that they're having problems, and memory issue is one of them. For instance, you come to a social gathering and the grandchild comes in, you don't remember him, or you don't remember the guy who you used to hang out with. It's a big issue. It's embarrassing to realize that some of the things I'm able to perform and do, I can't do them no more. So they begin to socially withdraw and avoid social, circumstances or environments.
Now, that's interesting to me, because the person actually realizes that they're not remembering. Are there any times when people really think they're on cue, and you know what I mean, and they're so off base because they don't realize that they're not, remembering the appropriate thing?
Right. In the early phases, it's they do remember, because I mean, like you talked about, losing your keys. You lost your key. Oh, you forgot the gas was on. You left it on and stepped out. Those are things you really remember, and those are early. Now, when it begins to occur more often, then you begin to realize, like, oh, what's going on? I'm having issues here, and then that's where a majority of people begin to seek medical help.
I hear you.
And then sometimes, it's the family member who recognizes these things.
Talking about family members, caregivers, what can some of the things that families can do when they realize that they have a family member that truly has dementia or Alzheimer's? What can a family member do to kind of ease the burden on that person and on the family itself?
Right. It's such a big medical concern and a burden on most family members, because if you have somebody who has Alzheimer's, then everybody is affected. And it affects every strata of the healthcare system, basically. Because you find out that at the early stages where you begin to notice what's going on, that's when the family member, it's really important to get close to, the loved one who's beginning to have problems. So where you begin to leave them cues in remembering stuff. For instance, leaving them notes by the bedside, marking the doors, giving them calls all the time, interacting with them, bringing them into social environments or social gatherings, just to help them, familiarize and spend the most of the time that they can get to help, improve the memory a little bit. As far as making sure that they're there, and making the individual, realize that they're there when the end time really comes. So it's a big form of support. And at that point in time, it's a time where you all gather together and make the decision of who's going to be responsible for, a power of attorney, making a decision in at the near and dead life span of the individual, and eventually deciding where the patient is going to spend the rest of their life, in the hospital or at home.
So well, we're going to have to end it there. Dr. Alua, thank you very much for coming in. It was such a great topic. Thank you very much.
My pleasure.
Thank you very much. We're just out of time. But in ending and in closing, caring and sharing, remember, www.medmoments.com, and tweet me at MedMoments. Alrighty, never institute any change in your medical care until you consult your physician. I trust each and every one of you continue good health. I'm Dr. Omar Bey, and this is A Moment in Medicine. Until next time, peace to you all.